Hi everyone, wanted to give this a second to go live again. I understand the video I just done previously. A lot of you were telling me had bad audio and it was really hard to hear. So deleted that from the page and doing this again to hopefully have a better sound. And I'm sure someone will probably chime in and let me know if the audio is sounding a lot better this time around. I changed phones, so hopefully that's the case. But Sunny, can you hear clearly? Hopefully, maybe Kayla can tell me if you can hear clearly as well. Our last video was really muffled. Let's see. So I wanted to come on. Okay, Mindy says it's better, so that's good. Wanted to come on and just provide as much clarity as we can today about the change in the testing numbers that you saw as we went down to 206, which of course is concerning and wondering what's going on with that. And so we do have a full news release posted, links to it here on social media and also on abilenetext.gov, so you can read in full detail there for yourself as well. Thanks, guys. Okay, good. I'm glad you can hear. But want to talk about why we have this 206 number. And so basically what had happened is that the health district was notified by the state that we needed to make two changes in our reporting numbers that we were putting out. Now, ultimately, it's good in that the numbers we had before that were out that were higher were erring a little more on the side of caution, but by making these changes, we're actually more in line with other communities across the state. So one change was eliminating one of the tests that we've been using, the district has been using and keeping count of. So there's two tests out there that happen. There's a PCR test, that's the nasal swab test. That's kind of the tried and true test that's used to account for positive tests. And the second test is a serology, it's an antibody test that you may have heard of. And so the state let the district know that we do not, should not be including the serology test positives in our total, and we had been. So that in itself accounted for 82 tests that we had in the positive count that needed to be taken out. And so that brings us a little bit more in line with what we're seeing across the state. And the other change that needed to be made was a little bit more on our end. It was needing to take out the positives that were coming from the Middleton and French Robertson prison units. So as some of you may be aware, those facilities have an Abilene address, but they're actually in Jones County. So those are 94 tests that we had been counting for in Taylor County that actually need to go over to Jones County. So those positives don't disappear by any means, but they should be accounted for in Jones County and not as something for Taylor County. So when you take the 94 of those inmates and the 84 antibody tests that should not be counted in our testing results, that gets us down to the 206 of where we are today. So wanted to explain that a little bit more. We got that written in the news release as well. And also just want to let you know, so we have the more simplified graphic that's there now. We'll be using that for the next few days because basically now health district staff needs to go through all of our information and data and redistribute, as far as if someone was needing to be Jones County, or if it was one of these antibody tests, and take out their age and their transmission type. So we'll take a few days to get that cleared up, but once we do, we very much intend to bring back the demographic information as well to have that posted there. So that's just a little bit more of an explainer on how we're at 206. So moving forward, we will be taking this 206 number and just moving up from there. And so you'll see that reflected in our posts moving forward. And I do know the health district too would like to just emphasize the need for folks to continue sanitization, social distancing, wearing your mask out in public if you can, that we have this lower number, but some of those cases we know are still out there. They're just in Jones County. And just that overall, we've done a good job of not putting a lot of strain and stress on our medical community. And so we'd like to just keep that up. And so that's a little bit more behind how we're at 206 right now. And we will continue to report what we have with that. But I want to give you guys a little bit more info, always more at abilenetx.gov. Thank you.